do better job of 3 minutes of belly dancing, but then all right, my name's Kanaf Kahol. I'm going to try and pull up my presentation. Yeah, while that's going on, let me actually tell you that there's a gentleman lady right there who just raised her thumb, and what she's doing is performing an ECG right now on a person. So if you look back, you can actually see a live feed of the ECG of the gentleman sitting right there. Okay, and she can come over and actually show it to you. There's a live feed. Some of you will just have to trust, and that's what Swasthya Slate is. Swasthya Slate is a device that actually allows you to do diagnostics on a mobile phone. It does 33 diagnostics. I can tell you whether you have dengue, malaria, typhoid, jaundice. I can tell you if you're pregnant. I can tell you if you have HIV, syphilis. We can actually do a bunch of urine protein. We can do cancer screenings. We can do diabetic measurements. We can do everything that is actually out there to be done. The good part about it is that I can actually do this for 50 rupees a person, and I can do it twice a year for an entire village. 50 rupees a person. If you do these 33 tests in a great path lab, which rhymes with ball, you will actually pay 8,985 rupees. So we've got the price from 8,985 rupees down to 50 rupees a year for these tests to be repeated twice. That is what Swasthya Slate is. Why did we make it? Because we spent around 6 months with frontline health workers in various spots who told us you cannot convince people just by providing them health communication. You need to tell them what's wrong with them. And that was the most powerful thing that we actually could hear. Now, 50% of people in our database that actually have diabetes do not even know they had diabetes. And the reason they got the diabetic test is because we are doing it for a very cheap price, and it was done in their house. They did not need to go to a clinic. The telemedicine system did not require them to work. The kit went to their house. Where do we have installations? Wow, what is Nitro? I'm just a lot of stuff. So this is all good old mathematics that's actually out there. I don't know if I can go ahead and somehow get to full screen here. But this is also something that it produces. Here's a map of the blood pressure heat map of the entire Hyderabad region. Because I get the GPS coordinate of every patient, I actually get what they're doing. I actually know that Kavadigoda and Padmarao Nagar are two hotspots, and that's where clinics should go, that's where all my efforts should go. The entire system is ISO 9241 usability certified, which means that we've beaten Apple to it, which I'm very, very proud of. So suck on that. Hey, I'm proud of it. And I don't like apples, so anybody who can talk to me about it, even though I'm from Himachal Pradesh. This is actually a heat map that actually produces all of this, and this is already starting to guide a lot of what governments are actually doing. Governments already know where their patients are. They can actually go ahead and track it. That's something that we are definitely moving forward. If a tablet system is not turned on for 10 days, I can tell, and I can then call them, hey, what's up? Why haven't you done that? You know, is it spoiled? Can we replace it for you? So the entire analytics system has been actually built up. Some more of these, and I don't know why, but it's very slow. Oh, yeah. This is another one of my favorite slides. Talk about being built in India, for India, of India, but being used for the world. We had governments of Timor-Leste contact us. They've taken a few. Government of Peru contacted us. They've taken a few. UK, Norway, Canada, Nigeria. And this is just the last 2 months that has actually happened. We have this new wonderful device, the one that actually does 33 tests. It's going to be long. Very happy that the first prototype is here. It's all certified and moving forward. And it's really very, very empowering that I can take an individual citizen and for roughly around 50 rupees or 25 rupees, literally give them all the services that they're going to require. And it's not just about diagnostics. It does cover a lot. 60 symptoms and 11 chronic care conditions can be managed by the frontline health worker using our decision support system right there. They don't need to wait to connect to a doctor. Okay, they can manage cough. They can even manage mental health conditions. They can manage if a client is agitated. So that is one of the big things, because even telemedicine reacts and relies on connectivity. We have a system where 80% of the medical conditions can be treated by the frontline health workers in the field itself. Okay, and that's where I think it really starts to blossom. So we're very proud of it. A lot of people in India are making this. This is a device that is directly employing roughly around 80 people. It was made completely in India. A lot of people tell me you can't manufacture electronics in India. They're lying. They haven't tried hard enough. A lot of people will tell you that software, the usability cannot be achieved in India. It can be. So this is an example of where I think we've created something and then the world wants. What we have to do is just get it out there. And that's what Swasthya Slate was always about. It was about listening to the people and understanding what they require. And the inspiration is right there. Thank you for your time.
Thank you, Dr. Kaul. There's one question from the gentleman there. I mean,
yes, sir.
Pass on the mic.
It was an excellent presentation in the manner in which, except for the belly dance, which we missed.
Belly dance would have been better, I promise you. I'll give you a private one.
I would, I don't like men doing belly dance for me, but I would rather have it on a mobile application.
Okay.
That apart, just a quick question. What about the privacy issues? Because
very good point, sir.
Just a second, let me complete, please. Thanks. There was an interesting statistic which you threw up about 2 regions in Hyderabad which are susceptible to high blood pressure. We know that we live in a country where not everybody is covered by the social or the health insurance. Sure. So clearly this data does not apply to us, or we are not so much susceptible, but we are moving towards a situation where very soon all of us, or at least I hope so, all Indians or all citizens of this country are covered by healthcare. What about the privacy issues? How do we protect that? Because that was a public information which is very private. Medical history is exceptionally private to any citizen.
I think, sir, first of all, thank you for mentioning that. I am from the US system. I trained there. I was there for 11 years. So one of the big things I'm very critical of is the fact that we have to do this. And I have made all my systems HIPAA compliant. For those of us who not know, HIPAA is the Health Information Privacy Act. That is actually an American act. It was actually meant for this type of thing. For those of you who've seen the movie Philadelphia, where a guy was fired just because he had HIV, I mean, that kind of situation can happen in India. So we have the entire database is 32-bit encrypted. It is protected. Let me give you an example, sir. When you get registered into a system, you get your patient ID, which is, with your card, you'll get a patient ID. In that patient, so you'll get something like DL577, which will be your patient ID, and I'll give you your personal key. Now, if you take your registered phone number and you just SMS our given number with your key and your ID, you'll get the results. But if your doctor wants it, he will actually have to get your sharing key from you and then give his key along with his ID. So we actually take this really seriously. In fact, what we have been very simple, even as we move forward and this becomes a data-driven economy and a data-driven system, I am committed as a company to make sure that no individual information is ever sold to any pharmacology agent, any telecommunication agent, or any hospital. Because we don't want a system where a hospital can just pull you in saying, hey, you're really screwed and we need you here. We don't want that system. And I'm absolutely committed to that. And if I'm not, you can find me and beat me up. I promise you that.
All right. On that note, you need to exchange cards so you can find them if you have to meet them up. So
Yeah.
all right.
I haven't seen a male belly dancer for long, so that's all right. That's the
all right.
beginning of
Thanks a
something.
lot, Dr. Kaul. On to the next one, shaping demand.